So this week, millions of Americans learned that a very popular blood pressure medication by the name of hydrochlorothiazide was being voluntarily recalled, which basically means the drug manufacturer is working in cooperation with the FDA to ensure this recall could be done. There was a basic announcement about this recall by the FDA, and subsequently news announcements were released from major media outlets and publishers like Nightly News, Time, Newsweek, Fortune magazine. But what are some of the details behind this recall? Why is this recall so important? And are drug recalls in the U.S. common? Well, we are talking about that today on episode number 20 of Overprescribed. Welcome to Overprescribed, the show that raises America's awareness on pharmaceutical medications, all in an effort to help you, the everyday consumer, to live the safest, healthiest, and most informed medication experience possible. Hi everyone, I'm your host, Mika Pollack, and thank you so much for tuning in to our 20th episode of Overprescribed. Today's episode was inspired by the recent hydrochlorothiazide recall. And I thought it would be good to not just talk about it, but share a little information with you about recalls in general. As U.S. consumers, we should know more about our medications, like where are they coming from and how these drug recalls work or are supposed to work. So before we get into this specific recall, let's talk about what a voluntary recall is anyway, at least according to the FDA. Okay, according to the Code of Federal Regulations, specifically Title 21, Part 7, a recall is a method of removing or correcting products that are in violation of laws administered by the Food and Drug Administration, or the FDA. Recall is a voluntary action that takes place because manufacturers and distributors carry out their responsibility to protect the public health and well-being from products that present a risk of injury or gross deception or are otherwise defective. 21 CFR 7 provides guidance so that responsible firms may conduct an effective recall. So this Title 21, Part 7 of the CFR goes on to state that a recall is an alternative to an FDA-initiated court action for removing or correcting violative products that have been distributed. It also sets forth specific recall procedures for FDA to monitor recalls and assess the adequacy of a firm's efforts in a recall. Recall may be undertaken voluntarily and at any time by manufacturers and distributors or at the request of the FDA. A request by the FDA that a firm recall a product is reserved for urgent situations and is directed to the firm that has primary responsibility for the manufacture and marketing of the product that is to be recalled. It concludes by stating recall does not include market withdrawal or a stock recovery. A market withdrawal is a firm's removal or correction of a distributed product, which involves a minor violation that would not be subject to legal action by the FDA or which involves no violation. For example, normal stock rotation practices, routine equipment adjustments and repairs, etc. And it concludes by stating that almost all recalls are conducted on a voluntary basis by the manufacturer. Let's talk about the specific announcement from the FDA's website, and I'll include a link to this in the show notes. This was made available for immediate release on August 27th, and it reads as follows. Abbott Healthcare Incorporated, so this is the drug manufacturer, is voluntarily recalling one lot, and that's lot number PW05264. That lot specifically accounts for 46,632 bottles of the pills And if you can't find the lot number, just so you know, FYI, if you can't find the lot number on your bottle, or on a bottle of a loved one that you're checking, you could also look for the NDC number, which stands for the National Drug Code. That's a unique 10-digit code used on human drugs in the U.S. And that number is also included here in the announcement. That NDC number is 16729-182-01. But anyway, it goes on to state, Accord Healthcare Incorporated is voluntarily recalling one lot of hydrochlorothiazide tablets, USP 12.5 milligrams, to the consumer level. A 100-count bottle of hydrochlorothiazide tablets, USP 12.5 milligrams, has been found to contain 100 spironolactone tablets, USP 25 milligrams. Since the individual lot, again, PW 05264, of the product is involved in a potential mix-up of labeling, Accord is recalling this individual lot from the market. Okay, so they're not recalling all of their pills, the hydrochlorothiazide tablets, but just this specific lot contains those 46,000 or so bottles. Okay. It goes on to state, let's see, based on findings of both preliminary and interim investigations carried out at the manufacturing site, Accord believes that no other lots of the hydrochlorothiazide tablets are involved in this mix-up. Okay, so Accord became aware of this finding through a product complaint reported from a pharmacy. And it doesn't mention any specific details about the product complaint itself or the specific pharmacy. It also states spironolactone tablets are indicated in the management of primary hyperaldosteronism, edematous conditions for patients with congestive heart failure, cirrhosis of the liver accompanied by edema or ascites, nephrotic syndrome, essential hypertension, hypokalemia, which is low potassium, and severe heart failure. Use of spironolactone tablets instead of hydrochlorothiazide tablets poses the risk of contracting hyperkalemia, so increase of potassium levels in certain individuals, resulting in adverse events that range from limited health consequences to life-threatening situations in certain individuals. To date, Accord, this is a drug manufacturer, has not received any reports of adverse events related to this recall. Hydrochlorothiazide tablets are indicated in the management of hypertension either as the sole therapeutic agent or to enhance the effectiveness of other antihypertensive drugs in the more severe forms of hypertension. So someone taking these tablets could be just taking just these tablets alone to treat their symptoms, or they could be taking this medication in combination with another medication or others. Accord's hydrochlorothiazide tablets, USP 12.5 milligrams, are light orange to peach colored, round, biconvex tablets debosed with H on the one side and 1 on the other side. An image of this product is below. If you're unable to view the image, please click this link. Again, I'll include the link to this entire announcement in the show notes so you can see the picture. The statement or the announcement from the FDA also states, if you're in possession of Accord hydrochlorothiazide that does not match the image, or if you are unsure, please return to your pharmacy or healthcare provider for confirmation. Accord is notifying its wholesalers, distributors, and retailers by letter and is arranging for the return of all recalled products. Wholesalers, distributors, and retailers that have product which is being recalled should discontinue distribution of the product and notify consumers. Consumers that have the product should return the product to the pharmacy. Consumers/pharmacies with questions regarding this recall can contact Accord Healthcare Inc. by phone at 1-855-869-1081 or fax 1-817-868-5362 or email at rxrecalls@inmar, this I, N as in Nate, M as in Mary, AR.com, Monday through Friday during business hours 8 to 5 Eastern Time. Consumers should contact their physician or healthcare provider if they have experienced any problems that may be related to taking or using this drug product. Adverse reactions or quality problems experienced with the use of this product may be reported to the FDA's MedWatch Adverse Event Reporting Program, either online, by regular mail, or by fax. And it goes on to also give you the link in this announcement, as well as to the MedWatch reporting system, as well as a link to the actual form that you can use to report any adverse reactions via mail or fax. And then it ends by simply stating this recall is being conducted with the knowledge of the U.S. Food and Drug Administration. And that's the full FDA announcement, pretty much verbatim. And I just want to make a point, just a summary point about this mislabeling. It was kind of described in the FDA announcement. I just want to make another quick underline on it. And that is that, again, this is a situation where that lot of pills, that those 46,000 bottles or so, were mislabeled. They should contain hydrochlorothiazide tablets, but instead they contained the spironolactone tablets. And this is an issue because it's going to pose a risk of hyperkalemia, which is increased potassium levels. And what does that mean? Typically, if you have increased potassium level higher than you should, that could lead to medical crises with your heart rhythm. And it could also even lead to muscle weakness. So it is a serious risk. Again, it mentions in certain individuals. Okay, so the success of this recall seems to hinge on multiple factors. For one, it seems to rely on drug wholesalers, distributors, and retailers to contact consumers impacted by this bad lot and to contact those consumers as soon as possible. So if this doesn't happen, if you weren't one of the millions of folks who may have seen anything in the news and got wind of this story from your healthcare provider or somewhere else, your only way of knowing this, if not from this podcast, would be from, one of those companies contacting you. So the source of your prescription, I would assume. Two, it's also hinging on or relying on consumers to take on a big bulk of the needed work to really make this recall a success, which is to alert their doctor, their pharmacy, the FDA, and even the drug manufacturer, whether it be questions or adverse reactions, or to return the medication in order to satisfy the recall expectations. So there's a good deal of communication expectation from consumers, as well as, I guess, hands-on involvement in making sure this mislabeled product is returned back to the pharmacy. So consumers are incredibly important in this recall process. Now, I find this recall intriguing for a number of reasons. For starters, drug recalls normally fall in one of three classes, but the announcement makes no mention of the class of recall for this lot, again, the specific lot number PW05264 of Abbott's hydrochlorothiazide tablets. As a matter of fact, drug recalls could be considered class 1, class 2, or class 3, with class 1 being the most severe. According to Wikipedia, class 1 recalls are the most severe and indicate that exposure and or consumption of the drug will lead to adverse health effects or death. Class 2 recalls refer to drugs that induce temporary and or medically reversible health effects, whereas class 3 recalls occur when adverse health effects are not likely to occur when consuming the drug or being exposed to it. That said, in reviewing those definitions from Wikipedia, it sounds like this drug recall may be a class 1, given the possible life-threatening consequences, again, in certain individuals that may experience the higher sides of the risk from taking the wrong drug in this recall per the FDA's announcement. This drug recall mentions that there were slightly over 46,000 bottles impacted, but it makes no mention as to where those bottles were dispersed and then subsequently dispensed and sold to consumers. As a matter of fact, there's no mention of specific stores or companies that dispense the bottles, and there's no mention of even geographic location as to where the mislabeled bottles may have ended up, even just a general region of the country. There's no mention of timelines as to when these lots were supplied across the country, and no mention of timelines in terms of when this problem was identified and when it's expected the recall will be fully addressed, or at least a target date to fully address this. Now, maybe this is a developing story and the details are being gathered as I speak, and also maybe this information isn't always readily available to the public. But from what I've learned in my experience on drug trials, the FDA wants as much information as possible when launching any investigation, particularly those that may impact patient safety. And they tend to be pretty serious with gaining those details and by specific deadlines. So it's a bit hard to believe that that information is not available at this time. Something else that I noticed that wasn't mentioned in this FDA announcement or most of the other media reports I've read or listened to was exactly how this mislabeling error occurred. And I guarantee you, a root cause to this problem will definitely be something the FDA will require to read and review from the drug manufacturer. And what is going to be the preventive actions that will be implemented to ensure something like this never happens ever again, particularly as it pertains to this drug manufacturer. Again, maybe this is a developing story, but I think consumers have a right to know this information, and the information should be publicly provided. If nothing else, to provide consumers with assurance and peace of mind that something like this will never happen again. Other questions that came to my mind after reading the FDA announcement about this recall was, who at Abbott, specifically Abbott Healthcare, is leading this recall? Now, you won't typically see named individuals in these types of announcements, but I did wonder because after visiting Abbott's website, there didn't seem to be much information about anyone at their company. No list of management or board of directors, no one. So it doesn't really leave you much understanding to Abbott's organizational structure or functional groups to kind of get an idea perhaps of what groups or what people may be actually leading this investigation or this recall. And I didn't see even a press announcement on Abbott's website about this. Now, again, who knows how quickly this all came to be, and maybe that's forthcoming, but I didn't see anything specifically on their website. Now, as I mentioned at the beginning of this podcast episode, hydrochlorothiazide is a very popular prescribed medication in the U.S. As a matter of fact, according to the WHO, or the World Health Organization, I believe it's listed as a safe and effective medication. And also it's on the list of essential medications for a healthcare system. Again, per WHO, the World Health Organization. I also saw on ProPublica.org that hydrochlorothiazide was listed in the top 20 of the most total Medicare claims, at least in 2015. And this gives us a window into the prevalence of this medication, at least for the over 40 million plus American recipients of Medicare in this country. So chances are most people listening to this podcast will know someone who has taken hydrochlorothiazide before or is taking it now. Now, before we end this episode, I just want to say that drug recalls are not uncommon. As a matter of fact, when looking at the FDA's website today, there were over 8 medication-related recalls in the month of August alone. This was for prescription and over-the-counter medications. So drug recalls don't appear to be going anywhere anytime soon. And if what I read the other day about the faster pace of drug approvals being correlated to a higher rate of recalls is true, then chances are some level of drug recalls for medications on the market today and soon to be on the market will be around for years and years to come. You just listened to episode number 20 of Overprescribed. Thank you so much for listening to the show. If you enjoy what you're listening to, please head over to whatever podcast listener you're listening from and leave us a review, whether it's iTunes, Google Play. We want to hear from you. We want to know what you think about the show. And if you ever want to email us directly, you can email us at talk@overprescribedpodcast.com. Again, that's talk@overprescribedpodcast.com.